Have you ever found yourself waking up at exactly 3 a.m., wide awake and unable to get back to sleep? It's a common issue many older adults experience, but it's not just a random occurrence. In fact, waking up at this time could be a signal from your body about underlying health concerns or changes in your sleep patterns. In this video, we're going to dive deep into the reasons behind waking up at 3 a.m., the potential impacts on your health, and most importantly, what you can do to improve your sleep quality. Stay tuned, and don't forget to subscribe for more insightful tips on living well into your senior years. 1. The impact of aging on sleep cycles. As we age, one of the most significant changes that occur is a shift in our sleep patterns. While we used to sleep soundly through the night when we were younger, seniors often experience more fragmented sleep. This is largely due to changes in the body's circadian rhythm, the internal clock that tells us when it's time to sleep and wake up. In older adults, this rhythm becomes less synchronized with the natural day-night cycle, leading to earlier waking times and more frequent nighttime awakenings. The 3 a.m. wake-up is often a result of this misalignment between the body's internal clock and the external environment. This disruption in the circadian rhythm can be further compounded by changes in the production of melatonin, the hormone that regulates sleep. As we age, the production of melatonin decreases, which affects our ability to fall asleep and maintain deep, restorative sleep. Without the proper release of melatonin, it becomes harder to stay asleep through the night, causing seniors to wake up early, often around 3 a.m., and struggle to return to sleep. This change is not a sign of aging alone, but rather a natural part of how our sleep patterns evolve as we get older. Another contributing factor is the amount of time we spend in each stage of sleep. Older adults typically spend less time in the deeper stages of sleep, like slow-wave sleep, which is critical for physical and mental restoration. Instead, we may spend more time in lighter stages of sleep, which makes it easier to wake up when our body or mind is disturbed. The 3 a.m. wake-up may occur during one of these lighter stages, especially when the body is in the process of shifting between different sleep cycles. While these changes are normal, they can lead to a significant decrease in sleep quality, leaving you feeling tired and unrested during the day. The body's reduced ability to achieve deep sleep is one of the key reasons why older adults often experience difficulty with sleep. Understanding these changes can help you adjust your sleep habits and environment to improve your rest. There are also lifestyle factors that can exacerbate these natural changes in sleep patterns. Poor sleep hygiene, such as using electronics before bed, consuming caffeine or alcohol late in the day, or having an irregular sleep schedule can all make it harder to achieve the restorative sleep you need. These habits can amplify the disruptions caused by age-related changes in the circadian rhythm, leading to more frequent wake-ups in the early morning hours. To combat these disruptions, try creating a more consistent sleep routine that aligns with your body's natural rhythm. This includes going to bed and waking up at the same time every day, even on weekends. Reducing exposure to bright light before bedtime, avoiding heavy meals, and practicing relaxation techniques can also help support your circadian rhythm and reduce the chances of waking up at 3 a.m. Lastly, while it's normal to experience some changes in sleep as we age, you can still improve the quality of your rest by addressing the factors that you can control. A well-maintained sleep environment, a regular bedtime routine, and lifestyle changes can go a long way in promoting healthier sleep patterns. Be sure to hit that subscribe button for more valuable tips and advice on improving your sleep quality at any stage of life, and learn how to get the best rest possible as you age. 2. Stress and anxiety can disrupt sleep at night. Stress and anxiety are significant contributors to sleep disruptions in older adults. As we age, we often find ourselves worrying about health, financial concerns, or family issues. These thoughts and worries can become magnified during the night, especially if you wake up in the early morning hours. For many seniors, 3 a.m. is a common time for these worries to take over. When you wake up, your mind might start racing, and it becomes difficult to shut off these thoughts and return to sleep. The impact of stress on sleep is well documented. When we experience stress, our bodies release cortisol, a hormone that triggers the fight-or-flight response. This increase in cortisol levels can keep you alert and on edge, making it harder to relax and fall back asleep. Cortisol can also disrupt the body's natural sleep cycles, preventing you from reaching the deeper, more restorative stages of sleep that are crucial for your health. As a result, you may find yourself waking up during the night and struggling to fall back asleep, with 3 a.m. being a common time for these wake-ups. Additionally, anxiety can manifest in physical symptoms, such as an increased heart rate, shallow breathing, and muscle tension, all of which can make it harder to get comfortable and fall asleep. These physical symptoms can prevent your body from relaxing fully, and as a result, sleep becomes more fragmented. The anxiety may also prevent you from entering the deeper stages of sleep, causing you to wake up feeling unrested and fatigued the next morning. For older adults, anxiety and stress may not just be triggered by everyday worries. The aging process itself can bring about feelings of uncertainty, fear, or sadness, particularly if you are dealing with health problems, isolation, or major life changes. These factors can create a constant state of low-level stress that disrupts your sleep, especially in the early morning hours when your mind and body are naturally more active. If stress and anxiety are affecting your sleep, it's important to develop strategies to manage these feelings. Practices such as deep breathing exercises, meditation, and mindfulness can help calm your mind before bed. Journaling or writing down your thoughts during the day can also help relieve some of the pressure that builds up at night. By addressing your stress levels and learning to relax before bed, you'll be in a better position to fall asleep and stay asleep through the night. Creating a peaceful and relaxing sleep environment can also help reduce anxiety before bed. Dimming the lights, using calming sounds, or incorporating scents like lavender can make your bedroom a sanctuary of relaxation. These steps can help signal to your brain that it's time to wind down and prepare for sleep, rather than worrying about everything that's on your mind. Finally, if stress and anxiety continue to interfere with your sleep, it may be helpful to speak to a healthcare provider or therapist. Therapy, counseling, and even medication can help you manage anxiety more effectively, leading to better sleep and improved overall well-being. 3. Health conditions and medication side effects. Health conditions commonly experienced by older adults can play a significant role in why they wake up at 3 a.m. For instance, sleep apnea is a sleep disorder that is prevalent among seniors and can cause interruptions in breathing throughout the night. This can lead to frequent awakenings, often at specific times like 3 a.m., when the body's oxygen levels are dipping. Sleep apnea occurs when the muscles in the back of your throat relax too much during sleep, blocking the airway. This blockage can cause your brain to wake you up briefly to resume breathing, which often disrupts your sleep cycle. Another common condition that affects sleep is restless leg syndrome, RLS. This disorder causes an uncontrollable urge to move your legs, especially when lying down or during periods of inactivity. RLS often occurs in the evening or at night, causing individuals to wake up with discomfort and a need to move their legs. The restless feeling can lead to multiple wake-ups during the night, and for older adults, 3 a.m. is a time when the discomfort from RLS can be particularly noticeable, interrupting their sleep and making it hard to fall back asleep. Chronic pain conditions, such as arthritis or back pain, can also disrupt sleep. As the body is more prone to inflammation and joint stiffness with age, pain can prevent seniors from staying in one position for long periods. This constant discomfort may cause multiple wake-ups during the night. If you suffer from pain-related conditions, the early morning hours might be when your pain is most intense, which explains why you could be waking up at 3 a.m. Additionally, many medications prescribed to older adults have side effects that affect sleep. Common medications for high blood pressure, diabetes, depression, and even pain management can disrupt the body's natural sleep cycle. Some medications may cause you to wake up to use the bathroom, while others might make you feel restless or have vivid dreams, which disrupt sleep. Certain medications also increase nighttime urination, leading to frequent trips to the bathroom during the night and disrupting your sleep. If your medication is affecting your sleep, it's important to consult your doctor. They may suggest adjusting the timing of your medication, changing your dosage, or switching to a different medication with fewer sleep-disrupting side effects. Managing your health conditions and their related treatments is crucial for improving your sleep and minimizing early morning wake-ups. 4. The role of hormonal changes in sleep patterns. Hormonal changes play a significant role in the sleep patterns of older adults, particularly women who are going through menopause or postmenopause. During menopause, women experience a decrease in estrogen and progesterone levels, two hormones that play a key role in regulating sleep. These hormonal fluctuations can lead to sleep disturbances such as hot flashes, night sweats, and difficulty staying asleep through the night. As a result, many older women wake up during the night, including around 3 a.m., due to these uncomfortable symptoms. The decrease in estrogen also affects the body's production of serotonin, which is a precursor to melatonin, the hormone that regulates sleep. With lower estrogen levels, there is often a decrease in serotonin, leading to reduced melatonin production and, consequently, more difficulty falling asleep and staying asleep. This can result in a pattern of waking up multiple times during the night, including at the same time each night, such as 3 a.m. For older adults, hormonal changes are not limited to women. In men, testosterone levels naturally decrease with age, which can also have an impact on sleep. Low testosterone levels have been linked to sleep disturbances, including poor sleep quality and a higher likelihood of waking up during the night. Men who experience low testosterone may find themselves waking up at odd hours, such as 3 a.m., and feeling restless or unable to return to sleep. Additionally, the circadian rhythm itself can be affected by hormonal imbalances. As we age, the body's internal clock can become less synchronized, leading to disrupted sleep. This misalignment can cause older adults to wake up earlier than usual, with 3 a.m. being a common wake-up time. Hormonal changes, along with the natural changes to the circadian rhythm, can lead to fragmented sleep and a decreased ability to stay asleep throughout the night. 5. Sleep environment and external factors. Your sleep environment plays a huge role in how well you sleep, and as we age, the importance of creating a peaceful and conducive environment for rest becomes even more critical. For older adults, external factors like room temperature, light exposure, and noise levels can significantly impact sleep. One of the main reasons for waking up at 3 a.m. could be related to your surroundings. If your room is too hot or too cold, your body may have trouble maintaining a comfortable sleep temperature, which can lead to frequent awakenings. Many people experience changes in body temperature as they age, and the wrong bedding or lack of proper climate control can result in waking up in the middle of the night. Similarly, light exposure can interfere with the body's natural circadian rhythm. Even small amounts of light, such as street lights or the glow of a digital clock, can trick the brain into thinking it's time to wake up. This disruption can be especially noticeable during the early morning hours, leading to wakefulness at 3 a.m. Noise is another significant factor. For some people, noise doesn't have to be loud to disrupt sleep. Even small sounds, such as a ticking clock, a snoring partner, or traffic outside, can prevent deep, restorative sleep. As we age, our hearing may become more sensitive to sounds that we may not have noticed before, making sleep disturbances more frequent. Even if you don't consciously hear the noise, it may still be affecting your ability to stay asleep through the night. 6. Cognitive decline and memory issues. As we age, cognitive decline can also play a significant role in sleep disruptions. Conditions such as Alzheimer's disease or dementia can lead to changes in the sleep-wake cycle, making it more likely for older adults to experience fragmented sleep. People with cognitive decline may have difficulty maintaining a consistent sleep schedule, leading to early morning awakenings at odd hours, including 3 a.m. This is often a result of the brain's inability to properly regulate sleep patterns and manage the natural sleep cycle. In some cases, cognitive decline may cause confusion, leading individuals to wake up in the middle of the night not knowing whether it's time to get up. This confusion can cause restlessness and prevent them from falling back asleep. Additionally, cognitive decline can increase anxiety levels, which further disrupts sleep. The inability to fall back asleep after waking up at 3 a.m. could be due to the mental confusion and stress caused by the condition. Sleep disorders like REM sleep behavior disorder, RBD, are also common in individuals with dementia. RBD causes people to physically act out their dreams, leading to disruptions in sleep. These disorders can lead to nighttime awakenings and restless sleep, which is often reflected in early morning wakefulness at times like 3 a.m. 7. What you can do to improve your sleep. If you're waking up at 3 a.m. regularly, there are several steps you can take to improve your sleep quality. First, consider implementing a consistent bedtime routine. A routine helps signal to your body that it's time to wind down and prepare for rest. Engage in relaxing activities like reading a book, doing light stretches, or practicing deep breathing exercises. These activities promote relaxation and help calm your mind before bed, making it easier to fall asleep and stay asleep. You should also try to avoid stimulants like caffeine and alcohol late in the day. Both substances can interfere with your ability to fall asleep and reduce the quality of your rest. Limit the use of electronic devices at least an hour before bed, as the blue light emitted from screens can suppress melatonin production, making it harder to sleep. Instead, focus on calming, screen-free activities that help signal to your brain that it's time to sleep. Establishing a regular sleep schedule is another important step in improving your sleep. Going to bed and waking up at the same time each day, even on weekends, helps regulate your internal clock and improves the consistency of your sleep cycles. This regularity makes it easier for your body to maintain a healthy sleep-wake rhythm and reduces the chances of waking up at 3 a.m. Conclusion. Waking up at 3 a.m. may seem like a random occurrence, but it's often a signal that something is affecting your sleep. Whether it's aging, stress, health conditions, or external factors, understanding the root causes of these early morning wake-ups can help you make the necessary changes to improve your sleep. By following the steps outlined in this video and addressing the factors that are disrupting your rest, you can enjoy better sleep and wake up feeling more refreshed. Make sure to subscribe for more tips on how to improve your sleep and live a healthy